Valvular heart disease. Most common valvular heart diseases are mitral stenosis, mitral regurgitation, aortic stenosis, and aortic regurgitation. Among them, mitral stenosis and aortic regurgitations are most common for example. Mitral stenosis. Management of mitral stenosis. Management includes clinical features, investigations, and treatment. Clinical features. Management of mitral stenosis includes clinical features. Clinical features include symptoms and signs. Most important symptoms are breathlessness and palpitation. Breathlessness and palpitation. These are most important symptoms. And signs, most important signs are pulse irregular, then precordium, palpation of precordium shows tapping apex beat, and auscultation shows loud fast heart sound, opening snap, then mid diastolic murmur. These are the common symptoms and signs of mitral stenosis. Now this in broad, the symptoms includes breathlessness due to pulmonary congestion, palpitation due to atrial fibrillation, more fatigue, low cardiac output, edema, ascites due to right heart failure, hemoptysis, pulmonary congestion and pulmonary embolism, cough, due to pulmonary congestion, chest pain due to pulmonary hypertension, symptoms of thromboembolic complications, such as stroke and ischemic limb. Signs include phase, mitral phases or Miller flash. Phase, mitral phases or Miller flash. Pulse irregular, then jugular venous pressure or JVP. Jugular venous pressure if right heart failure develops, there will be raised JVP. Examination of the precordium, palpation of the precordium, tapping apex beat, palpable P2 if pulmonary hypertension, left parasternal hip, and epigastric palpation, and epigastric palpation may be found if there is a right ventricular hypertrophy. Auscultation shows loud fast heart sound, opening snap, mid diastolic murmur. Low pitched mid diastolic murmur localized in the apex, no radiation. Best heart will be with the bail of stethoscope with the patient in left lateral position and breath holding after expiration. There may be pre-systolic accentuation. Loud P2 may found if there is pulmonary hypertension. Loud P2 may found if there is pulmonary hypertension. Signs of raised pulmonary capillary pressure. Signs of raised pulmonary pressure. Crepitations and effusions. Investigations. Investigations include ECG, chest X-ray, echocardiogram, Doppler, and cardiac catheterization. ECG shows left atrial hypertrophy, P mitrally if not in atrial fibrillation. Left atrial hypertrophy. ECG shows left atrial hypertrophy. Left atrial hypertrophy, P mitrally if not in atrial fibrillation. Then right ventricular hypertrophy. Features of atrial fibrillation. Chest X-ray, enlarged left atrium and appendages. Chest X-ray shows enlarged left atrium and appendages. Signs of pulmonary venous congestion. Echocardium shows thickened immobile cusp, reduced valve area, enlarged left atrium, and reduced rate of diastolic filling of left ventricle. Doppler. Pressure gradient across mitral valve. Pressure gradient across mitral valve. Pressure gradient across mitral valve. Then pulmonary artery pressure, left ventricular function. হ্যাঁ আইছিল না যে আইতে যেমন আরেকটা আছে, তার আমি শুনি।